Good morning, everyone. Good morning. This is Owen. Some of you may not know who Owen is if you're newer followers of Camp Cocker. Owen is, he was rescued in 2012. And he actually, when we rescued him in 2012, he was supposed to be around 5 years of age. And he had a knee surgery, he had cherry eye surgery, ear infections, all the Cocker stuff. And once he got all fixed up in 2012, he has been healthy ever since, except for crystals in his urine that is now being controlled by Chinese herbs. Anyway, Owen never got adopted. Actually, Owen was adopted once and returned like in 36 hours because Owen has some handling issues and he has some fear issues with being handled by strangers, even by people he knows. And so he actually was up for adoption for about 5 years. And then we took his adoption listing down, and I've just been permanently fostering him. And actually, when we closed our Forever Foster Home program during the pandemic, I just personally took on responsibility for Owen's medical bills, which he has not had very many. Right, Owen? You've been pretty healthy. Well, a few days ago, last Wednesday, he didn't finish his breakfast and dinner, which was unusual. And then Thursday morning, he didn't eat at all. So then we went to the vet. So Thursday was when we started going to the vet. We've been going to the vet every day. They did blood work on Thursday, gave him some fluids, a Serenia injection. On Friday, we went back. They rechecked his blood work, and some levels in the blood were concerning enough, and some levels were dropping that our vet sent us to an internist. So luckily on Saturday we got in. The internist squeezed us in for an appointment at 3:00, and Owen had an ultrasound on Saturday. What the internist observed on the ultrasound is two things. Owen's, the center segment of his intestines has swollen tissue, and his bladder has some abnormalities. So abnormalities is a generic term that a vet will use when they can't identify what's going on. They see something that's abnormal. That's basically what they saw. So on Saturday, the internist said we could stop doing diagnostics and assume that it's something bad like cancer, or we could actually seek a diagnosis. And to seek a diagnosis means a surgical procedure for Owen, where they're going to go into the intestines and the bladder and take tissue samples out and send them to the lab for biopsy. So I know Owen is 15 years old, and a lot of people with 15-year-old dogs would have stopped. They would have been like, nope, I'm not going to spend any more money. Let's euthanize our dog. But in light of the fact that Owen has been relatively healthy for 10 years, I mean, he's not a sickly dog. He hasn't been on a decline. And since it seems to be an acute issue of him not eating, we decided to move forward with the surgery to get the tissue samples taken out for biopsy. So we were waiting to get on the surgical schedule at the main hospital where the internist works, and they're busy. And then yesterday we took Owen to our vet who's open 7 days a week, Oaks Veterinary Urgent Care, to get more fluids. And they actually, they ran more blood work, and the levels in his blood are dropping again. It's protein, and it's another thing, and I'm not sure I'm saying it right, albinum. I'm sure I'm not saying that right. ALBINUM is dropping in his blood. So our vet at Oaks Vet said she would come in today on her day off to do Owen's surgery. So we're so grateful. We have so many nice vets that we work with. So Dr. Karen's going to come in today on her day off to Oaks Vet, and she's either going to do the surgery or she's going to cover for the other doctor who's working tonight, and the other doctor, Dr. Rachel, will do Owen's surgery. So Owen's going to go in today for surgery to get the mass tissue samples taken from his intestines and his bladder, and we'll send that out for a biopsy. He's really not eating, although yesterday after, he got more fluids yesterday, and after he had the fluids, about an hour later, he ate a whole bunch of treats. They were just beef, dehydrated beef treats from Just Food for Dogs. He ate a whole bunch. So I think the fluids are helping to perk him up. Anyway, so that's what's going on with Owen. Owen's the unofficial mayor of Camp Cocker because he never got adopted and he's always been a presence. So anyway, just if everyone can just send some positive energy and positive wishes for Owen. Maybe it's a mistake to do the procedure and gets tissue samples out for biopsy, but maybe it's not. I don't, it's just, it's like with human medication. You just don't know what you're dealing with till you get a diagnosis. And if you don't have a diagnosis, it's hard to make a decision to euthanize a dog. So I don't know. So we're trying to get a diagnosis for Owen. Owen, so many people love you. So many people love you. You're the mayor. You're the unofficial mayor of Camp Cocker, right? You've been watching over things for so long. So anyway, send some positive energy to Owen today. He'll be in his surgery later on, late afternoon. And the good news is we don't think he's in pain. He's just feeling yucky. Owen's feeling yucky. So hopefully we can get the tissue out, send it out to the lab for a biopsy. I know biopsies can take, I don't know, maybe a week. Hopefully we'll have some answers to see what's going on. And Owen, we got to get you to eat though. So until he's eating again, we'll just keep taking him to the vet every day for some fluids, because the fluids seem to perk him up enough to get a few bites of food in, even if he just eats like a half a handful of treats. It's something to sustain him, right? Okay, Owie. But yeah, he doesn't seem like he's a 15-year-old, right? He just doesn't seem like a 15-year-old dog. Owen, you look like you never age. You're ageless. What's your beauty secret, Owie? He's like, I just look like I look. I just look handsome. Oh, little dude. It's so hard to see our dogs when they get older like this or when they get sick. It's so hard to not know what's going on. But, we're so lucky that veterinary medicine has modernized so much that we can do things like this for our dogs to get a diagnosis. I mean, I remember growing up in the 60s, my parents never would have done anything. If they had a dog that stopped eating, they would have euthanized. They didn't even go to a vet to ask for a diagnosis. It's just, things are just so different now. And dogs are family members, at least to people like us who are dog people. So Owen's been a good boy, and he deserves to at least get a diagnosis. Right, Owen? You deserve the dignity of a diagnosis. So, all right, everyone, that's what's going on with the mayor. Just send positive energy and your love. Just send love. Just send some love from your heart for Owen. All right, Owen, a lot of people are sending you love today. All right, thanks for watching, everyone. Keep Owen in your thoughts today. All right, bye.